Well, it's Friday morning, everyone, and this is RVN TV. My name is Joe Osmendi.
I'm Alcini, and it's always a pleasure working with you, Joseph.
This is CEO
Nice
Chat.
to see you.
Absolutely. We're brought to by Holloman and Solomon Cigars. Hiram and Solomon Cigars, as usual. It's our sponsor.
Good.
But we have a special guest today, Al.
And who is
special.
that?
This is
Would that
Jessica.
be this woman right here?
That woman right there. That one right there. Jessica
to meet you.
Baliski. Right. Jessica, welcome to CEO Chat.
Thank you for having
Jessica Baliski, is that
Right.
right?
Yes, Baliski.
Baliski.
Many people say Balinsky.
Like
they
Joe-
add an N in there, but it's Baliski.
It's Baliski, that's great. It's nice to meet you, great having you on the
There
program.
used to be a baseball player by the name of Bo Balinsky, but that was a long time ago. But you're Jessica Baliski, okay?
Correct.
And you're a senior speech language pathologist, okay? Proud owner and founder of Onward and Upward,
Yes.
okay? And you deal with language evaluation, correct? Why don't you tell us exactly what you do?
Well, it's really funny because when folks think about speech therapists or speech language pathology in general, you think of somebody treating stutters or, different sound deficits or being non-intelligent, but that's not the case. A lot of speech language pathologists were trained medically to treat cognitive disorders,
Okay.
including giving cognitive linguistic therapy after a serious heart attack, stroke. So we have a lot of different hats,
Okay.
and we have a lot of different specialties.
Okay.
So it gets very, very interesting, and I have a wonderful passion for my field.
It sounds like you really get into it, and that's
Yeah.
and well, you can do an awful lot of people, an awful lot of good in that field too. It's a specialty field, and there aren't that many practitioners in it. And
Correct.
You prefer early intervention, working with children, or do you have?
So my background and my passion lies with helping those with mental illness and directed at mental health,
Okay.
just to promote mental wellness. So for the last 10 years, I've served adults. So I've been of service for adults that need me. After a serious neurological event, it could be anything from, an unexpected diagnosis, stroke, heart attack, you name it. But of last January of 2019, I decided it was my time to open a private practice.
Okay.
And switch my gears and make a major transition to start working with children.
All right.
Oh, good.
Just to be part of the child study team, to decipher, if the child presents with a language disorder, if they're just delayed and need a little bit more stimulation and help, or, if they have a cultural difference, and just being understanding and mindful of, the individuality of every child and patient.
Great. So for people watching our program, number one connection that we'd want to make would be school administrators, I guess, who are looking to add this kind of talent to their child study team. Would that be somebody you'd want to connect with?
I proudly serve the Hope Charter Community School in Camden right now.
Okay.
I just won the Kindness Award, which is awesome.
Congratulations.
Because there's a lot of cyberbullying going on, especially in 2019. I know I don't want to be a child or a teen
Right.
in today's technological world, so I'm proud of all the professionals there. They do a really wonderful job
Wow.
of being compassionate and understanding.
Okay.
But yes, as for right now, my private practice is expanding. It's only been, it's still a baby, it's still
Okay.
8 months old.
Well,
Congratulations, though. That's
congratulations on that
great.
too, exactly.
That's great. And you can do this for anybody, anywhere. I mean, you mentioned before the program that you're comfortable on Skype, so you can coach people, help families
Yes.
remotely.
Professionally, when you're dealing or, you're discussing very serious topics with folks that may be comfortable or uncomfortable with the terms.
Right.
There is a HIPAA form. We need to protect people's privacy and respect their privacy. There's a big privacy breach right now, and I think that privacy is very, very important. Using the app Zoom is the most professional way to get through via telepractice and private practice.
Okay.
But I am licensed to enter any hospital, rehab, home, and or school.
Oh, that's
How do you
great.
start with somebody? Do you do a language evaluation, or how do you start?
It's a very intricate evaluation.
Okay.
And there's a lot that goes into an evaluation, whether it be an adult and or children. So there's standardized materials and also non-standardized materials. I don't think that standardized testing alone gets the true message of the individual, whether child or adult. I think we need to bring non-standardized materials in, more of observation and instinctual, your intuition about what's really going on.
I'm thinking outside of the box.
Exactly.
Great.
So you're
I'm just
dealing-
one piece of the puzzle.
Oh, but a big piece, a big piece.
Yeah.
So your practice has really switched from adults now to children, correct? Mm-hmm. And you're dealing with the school districts, basically?
Yes.
Okay.
Yes. And, I just feel as if children are children, no matter what school district they are from.
Doesn't make any
No
difference, it's the
matter-
same.
When we all close our doors at night, we're all the same.
Right.
We
Exactly.
need to take a break. We just got the sign. So
Okay.
we'll take a break. We'll be right back with more CEO Chat after these messages.
Stay where you are, don't go away.
Shelter dogs aren't
Really
broken.
good.
They've simply experienced
How you
more
doing?
life.
That's not
If
a
they were
mimosa,
human,
that's just
we
coffee.
would call them wise.
Is there anything you
They
want
would be
to
the ones with tales to tell
Everything okay?
and stories to write. The ones dealt a bad hand who responded with courage. Do not pity a shelter dog. Adopt one.
Say we've got grit, and we'll take it as a compliment. Because it's our uncommon drive, our spark within, that brings us together and sets us apart. We are temple made. And when others take shortcuts, when others take breaks,
That's why you said extra.
when others take the easy way, we take charge.
Table food. Right. We all good.
Add us on social media
That changed.
to watch bloopers,
Share a review.
behind the scenes footage,
Well,
previews, and more.
In the airport, I'm like, yes, he's fine.
I work 13 hours a day, 6 days a week. So when I'm off the clock, I gotta get stuff done. So when I need a snack, I need something healthy, tasty, and easy to eat. Like wonderful pistachios without the shells. They're protein powered, delicious, and great on the go.
Oh.
And that's perfect for
So,
me.
I guess as part of
A
what you
woman
do,
without-
the root cause, trying to figure out what the root cause is. That's speech
lot of
pathology. Is let's
time.
figure out what it is that you're having, what it is that's causing the difficulty you're expressing.
Whether you're a gourmet
right?
cook or
So
just
it could
want to
be
eat like
emotional,
one,
it
visit
could be
Rastelli
cognitive,
Market Fresh,
it could be
your
a
home for
physical
the freshest,
impairment.
locally sourced ingredients to please
could be
everyone
somebody
who
after an
loves
accident
great
maybe
food.
that's got an
Our
injury
organic
and
meats,
has to
quality
overcome
seafood,
that.
and free-range poultry are cut fresh to order.
I bet you
Chefs
have, and
create
I'll bet when you work with
culinary-inspired prep
Medicare, you
foods
probably
made
work with
fresh
stroke
every
victims,
day,
too.
which pair nicely with our vast
Okay, so
selection
that
of
was a
fine
big-
wines and spirits.
Really
Choose from
veterans.
handmade
What about
pastas,
veterans? That's
artisan
PTSD,
cheeses,
so
organic
that's,
produce, and grocery
actually,
items,
that's
all
another
from the
reason for you
finest
maybe to talk to
purveyors.
Mike.
Rastelli
And,
Market Fresh, from our family to
Mike
yours.
has a program called Bridging the Gap, which
RVN
about
TV is a
preparing
platform for
veterans the next
people of
stage in
any
their career
industry to
after
share
they
their
leave the
story.
military.
Over
But a lot of it could be somewhere in the middle of
285,000
during in that
viewers
gap,
are tuning
dealing
in to
with
RVN
what they have to
TV
deal
shows
with
monthly.
to overcome that.
We guarantee a great experience that you'll be sharing with everyone you know
That's an
while
interesting-
increasing your personal and company's brand awareness. But what is your brand? According to Forbes, it's a combination of your logo, your product, your design and feel, and your personality.
So it's an underserved
Did you know that aside from being a guest, we offer even more opportunity to boost your brand? Adding your company logo and website on screen during your interview will allow viewers to recognize your brand instantly. Incorporating images and video clips is another great way to showcase your product during your live segment. Let viewers see how good you really are. And most importantly, there's you and your interview. For less than the cost of a newspaper, direct mail, or a magazine ad, you can leave our studio and within 48 hours have a permanent digital copy of your live segment to link to your social media, embed into your company website, or use in email marketing. Investing in your brand is so very important, and we can't wait to have you as a guest.
100%. And I
Shelter dogs aren't broken.
My sister said that to me last night. My sister
They've
said that to
simply
me last night. She
experienced
said,
more life.
"Intimidate me."
If they were
There's your
human,
emergency room
we
nurse.
would
Nothing
call
gets
them
by
wise.
you. No, nothing gets by
They would be
you.
the ones
I'm
with
scared
tales
of
to
her.
tell and stories to write.
I'm scared
The
of her.
ones dealt a bad hand who responded with courage.
She has a license.
Do not pity a shelter dog. Adopt one.
And my brother-in-law was like, well, I have a license to grill.
Say we've got grit, and we'll take it as a compliment. Because it's our uncommon drive, our spark within, that brings us together and sets us apart. We are temple made. And when others take shortcuts, when others take breaks, when others take the easy way, we take charge.
Mimosas. Let's go.
Yeah, well.
Add us on social media to watch bloopers, behind the scenes footage, previews, and more.
I gave her one of these looks. And she's like, okay, I won't bother you. Give the look at that.
My granddaughter has a PlayStation 4 virtual reality headset.
I work 13 hours a day,
Oh,
6
that's
days a
actually
week.
the
So when
future
I'm
for
off the clock,
cognitive
I gotta
therapy.
get stuff
Do you know
done.
That's what we talk
So when
about
I need a
technology
snack,
has
I need
changed
something
it.
healthy, tasty, and easy to eat.
Actually, it's an interesting-
Like
after a
wonderful
car accident,
pistachios
like,
without the shells.
learn to
They're
drive
protein
again.
powered, delicious.
Well, welcome back to CEO Chat. I'm Joe Asamendi.
I'm still Alcini.
And this is
I'm
Jessica.
sorry, I've been waiting years to say that.
But you're Jessica Baliski.
Yes.
And Jessica, so welcome so much to CEO Chat. You have so much to talk about.
Great guest.
Right. We understand also you work with a lot of veterans. Is that correct?
Yes.
Okay. What are some of their problems?
Well, we are the land of the brave, or land of the free because of the brave.
Mm-hmm.
And I have had the pleasure to treat many veterans that have to transition after being exposed to tremendous amounts of trauma. So I not only understand that trauma, but what I do is I hold space for them to, move onward and upward from whatever they experienced.
Well, that gets us into a discussion of the process we had a little bit during the break. You've got somebody who's presenting with speech impediment, some difficulty in expressing themselves. Getting to the root cause of that could take you to a physical impairment, or it could take you to an emotional or cognitive impairment. Or you also have treated stroke victims. I know people who've had brain injuries.
Yes.
And getting to the bottom of it is really kind of the first step, isn't it?
Yep, getting it out.
Yeah.
Better out than in.
And a lot of people are reluctant to talk about it because talking is their weakness to begin with.
It's very
So-
uncomfortable. There are a lot of conversations that are very hard and difficult to have, but we have to have them.
Right.
Yeah, we do have to have them, and you use humor in your practice.
I love humor. I think if you can laugh about it, you can heal it. I mean, I think laughing is my favorite.
That's like my favorite too.
It takes a stigma off it also.
Yes.
That's the biggest thing.
We need to crush the stigma, I think, and we have to work as a collaborative team.
Great. So when you're working on the child study team, you're working with the teachers for children, for example, with the teachers, with the aides.
Yes, wonderful, wonderful health professionals. Everything from teachers to social workers, nurses, doctors, special ed teachers. I mean, even to the custodians. Everyone is a part of the team.
You're really all part of it. Anybody that the child might interact with during the day
100%.
is somebody they're talking to. So everybody really needs to know what it is they have to deal with. I think that's such an important part of resolving a problem. like this.
100%.
Yeah, that's great. So one-on-one with the child who has the problem. Typically, that's how you work. So they identify a child.
Sometimes I work with the children individually, or sometimes I group them together because they benefit from learning from each other.
Okay.
Oh, okay.
I think competition is something that's not so good, but also, if you group them together, they can learn from each other and learn to work as a team early on.
Early on, and
Yeah.
become. I was going to ask you too. How long does it take typically to resolve a problem? But you don't necessarily get to a resolution exactly. It's not like you're curing something. You're
Right.
helping people cope with something to deal with it.
So coping mechanisms, compensatory strategies, anything that's going to help them succeed and get through whatever they're going through. Because we all have issues. We all have flaws. And perfection does not exist.
Right.
As much as you strive for it, right? So I'm like a recovering perfectionist. A lot of speech language pathologists are very type A.
Really?
Oh, really?
Okay.
But we're goal setters in the healthcare
Just want
industry.
to move forward. I want to know how much progress we're going to make today, What kind of progress can we look to next week when we get together? And is it a weekly thing? Do you get together on a...
Yeah, a lot of team meetings and a lot of conversations that are very hard to have. I believe that, your health is your wealth, and taking it very seriously and working as a team to figure out, how we can problem solve. Not stop talking about the problem, do something
Let's actually
about
do
it.
something about it. And
Right.
see, how cooperative are parents typically in this process?
Parents are very cooperative. They want the best for their children, for sure. It's just about education. Every parent wants the best for their child. I mean, that's unconditional love.
How do you deal with it, though, when maybe the parents are part of the problem?
Counseling.
Really? Okay. Because I'm
Counseling.
thinking stress and PTSD
Yes.
in the home could
Stress,
be a...
stress is the biggest killer. And I think we all have it. Just have to have the conversation.
Yeah, in order
Right?
to get
Stress
to the resolution
management.
of it.
Yeah, I just went to a continuing education unit on stress management, and it's a very important part, of just even being a business owner or just a professional in general.
Yeah.
Not even healthcare, any profession.
You're also an adjunct professor at Stockton University, correct?
Yes.
Tell us a little bit about that.
So I had an incredible opportunity to speak and teach inspiring speech language pathologists at Stockton University. So they just were named a university.
Okay, it used to be Stockton College.
Yes, at the time that I was teaching. So I was teaching a night course, and the night course was called Language Disorders Across the Lifespan. So it was just speaking about children that are in the NICU, children that are in elementary school, the very hard, ever-changing subject of autism that is being researched right now, ADHD, auditory processing, and then I went on to speak about adults, traumatic brain injury, aphasia, which is a neurological condition that happens after stroke and or heart attack, also dementia, having the talk about dementia and the fears of, and just being mindful, that we're all in this together.
Together, that's
Right.
it. So disarming people, making them feel comfortable with you, that's
Exactly.
kind of the first step.
Exactly.
They have to know that you made the joke that you're kind of intimidating, but you're really not in that setting. I mean, the truth is you have to give people the feeling that you're there to help them. And,
Yes, I
you
think-
push them a little.
100%. I think
Yeah.
it's just establishing trust.
Yeah,
Right.
that's
Because
important.
we all have fears, and
Sure.
facing them is the true way to get anything done.
Sure.
Right?
What's the youngest child you've ever worked with?
2 years old.
2 years old, really?
But there are wonderful speech language pathologists, even at Children's Hospital of Philadelphia,
Really,
that work with NICU babies.
Oh,
very early intervention.
Very early on, working on a lot of the swallowing and the suck, swallow, breathe sequence and feeding.
Oh, really?
A lot of a speech language pathologist's job is to help with swallowing disorders. A very fancy word for a swallowing disorder is called dysphagia.
okay.
Interesting.
So, NICU babies and even adults, if you can't swallow your nutrition, we're going to have to find an alternative.
And that's, if you don't fix that early, it's a lot harder later to unlearn that, I guess. That's a big
Yeah, but there is research out now that, that whole thing, you can't teach old dogs new tricks. I think,
Joe knows that. now you're working up our street.
I think you can. I think it's possible.
That's encouraging.
I do. I've seen miracles with my own eyes.
The old
I really
reality.
have.
No, that's great, I think. And actually that sense of satisfaction you get from actually making a difference in
Yes.
somebody's life.
And just gratitude in general. I think that if, we can all be grateful for what we have every day, it'll be, we'll raise the consciousness. We'll raise our vibration and just
I think
go
that's cool.
onward
And
upward.
and upward.
There you go.
Has technology made a big difference in what you do?
I think we fear technology too much. I think it's really helping research,
Okay.
not only cancer research, but research in general. I think it's helping with MRIs. It is enhancing a lot of healthcare, and I think we need to make friends with it.
That's important. I think that's a really great point. What kind of technology do you use in the treatments that you do?
I am vital stim certified, helping a lot of the facial nerves. And then also I get placed it on the neck to help with the swallowing. So that's one of the technological instruments that I would use during my treatment. There are different modified barium swallow studies that we do at the hospital because we can't look inside, you know, to see if when you take a sip of, if it goes down the right pipe or the wrong pipe. We can't see, but we can see it on x-ray. So we do what is called modified barium swallow studies in the hospital.
Oh, wow. That's great.
So we just put barium in the liquid and we just see,
Follow it.
Follow it down.
investigate where that liquid's going.
Sure.
Because if it's going down the wrong pipe, it goes into our lungs and we cannot digest in our
And we
lungs.
can't, I mean, and then that increases your stress level.
100%.
And when your stress level goes up, it makes the problem even worse. So now you're in a spiral. And I'm sure training people to kind of step back from that spiral, step out of it, calm down, and then sort of get back in, that's got to be a big part of what you do.
Yeah.
Real contribution. And you love doing this.
I love it.
Okay, why? What do you love about this?
I love expression in general. And I love when people can express themselves healthily. It's a passion of mine, healthy communication. I find it wonderful and I find it healing.
Good.
And I think that when things are kept to yourself, there's no way to heal it, right? So you need to express it.
When did that start? When you were 4 years old, did you say, I want to be a speech pathologist when I grow up?
I wanted to be a model actress, but then I realized really quickly that,
It's a tough field.
yeah.
It is. It's a tough field.
But you could have.
I could have.
You could have done that.
My father was very apprehensive about sending his 17-year-old daughter to New York for acting. So instead, I went to medical school.
That's okay.
50-50, and I think you chose correctly.
Yeah,
So,
yeah.
no, that's great.
We are the sum of our choices.
You're not one who plays a doctor on TV, you're a real one.
An actual real doctor.
Yeah, I'm not a physician. I'm just, I have my master's of science. I studied heavily in neuroscience. I find it fascinating. I was lucky enough to learn under Dr. Bob Volan, the founder of the speech language pathology unit at New York Medical College. And I was just so very lucky.
That's great. And you also mentioned before the program, too, that you work with children who are on the spectrum.
Yes.
And autism
Yes.
as a cause for all this.
It is such an umbrella term. There are so many different severities.
Right.
And it is very interesting. That's why we're still studying it.
It's still being studied,
Yes.
but that's an area where you can make a difference. And when you help with something like speech, you're actually helping with a lot of the other parts.
100%.
I mean, that's you're fixing the whole person, not just that one part of them.
Well, two things we can't predict in this world is weather and behavior.
Okay.
That's why we picked this line of work. No, but I think it's great that you approach it that way.
Yeah.
But you had such enthusiasm for your work.
Yes.
And that's effective. It's very effective, I imagine, when somebody knows you for the first time and they have a problem, they come to you because they can relax and understand.
You need
express themselves.
you need to trust a health professional with what's going on. You need to trust them. And I think humor is a great way to cope with anything that you feel uncomfortable with.
Well, helping people to laugh, not laughing at them.
Yes,
certainly,
and
but
I will
laughing
be
with
a
them.
goofball. I will be goofy, okay? I will be goofy. It's fine.
Good. But HIPAA restrictive too, so that nobody knows anything about what's going on.
Respecting the privacy.
Yeah.
I think it has to do with respect, 100%.
With that.
Everyone is entitled to respect and privacy because we all have the same shot in life, right? But we're the sum of our choices.
Terrific.
Yeah, that's exactly right. And I think what I get from you, what you do is people that come in maybe a little afraid or something, you have to take those barriers down so that they feel comfortable with you and they feel comfortable with knowing that they can get better at what they're doing.
Disarm those fears, right?
Sure.
Progress is possible. I believe in miracles. I've seen them.
Yeah, good for you. We're at that part of the program where you get to look right in the camera there on the left. And actually, I guess, pick a camera. And tell everybody how to reach you.
You can reach me on my website at www.onward.slp.com.
Jessica Baliski, it was wonderful having you. Thank you so much
Thank you for
joining
having
us.
me.
Absolutely great to have you on the program, Jessica.
thank
it's nice
you.
meeting you.
Pleasure. Good. And thank you for looking at CEO Chat as usual. Until next week, I'm still going to be Joe Osamendi.
I'm going to change my name this week, and I don't know what it's going to be, but whatever it is next week, I'll be here.
Okay. Have a wonderful weekend. And be
Thanks,
safe,
everybody.
and we'll see you next week. Bye now.
Thank you, guys.